Hi guys, Dr. Kid here. In this video, I'm going to show you 6 must-know exercises to help you with your de Quervain's tenosynovitis. Now, what is de Quervain's tenosynovitis? Well, this is a condition that affects two tendons on the thumb side of your wrist, named the abductor pollicis longus and extensor pollicis brevis. What these tendons normally do is that they attach some muscles to our thumb and help us move our thumb in our everyday lives. Surrounding these tendons is something called a synovial sheath. And what the synovial sheath does is that it reduces friction. When there's a lot of excessive repetitive activity of the wrist, this is where that synovial sheath can get very inflamed, and hence tenosynovitis. Tenosyno, which is the tendon synovial sheath, and itis is the medical term for inflammation. Now, sometimes initially, de Quervain's tenosynovitis can be really inflamed and really painful. In this instance, what I recommend before starting the exercise is resting the wrist, wearing a brace, using some ice and some anti-inflammatories for 24 to 48 hours. This should usually dull it down to a more comfortable level, and then we can start the exercises. Now, the first stretch is a simple wrist stretch. It's done by putting your wrist like this and putting it down in this position, holding it gently with your other hand, and holding it for approximately 15 seconds. Typically, we do this about 5 times. You should feel the stretch just along here in the wrist muscles. The next exercise focuses on thumb mobility. This is done by touching our thumb to all of our fingers in succession. You can do this 15 times and then do 3 sets of those 15 repetitions. Now we'll move on to some strengthening exercises. Our first strengthening exercise will focus on grip strength. What we do is basically we grip an item. I'm going to start here with some rolled up socks, which is the first level. But as you get stronger, you can move towards a stress ball and then a tennis ball. So all you do is just squeeze the rolled up socks, hold for 10 seconds, and then repeat this 10 times. Our next exercise is wrist extension. Wrist extension is this movement here. And we can strengthen it simply by using a bottle of water, putting our wrist off the edge of a bed, and just lifting up the bottle of water like this. A typical dosage that I would prescribe for patients is 3 sets of 15. Our next exercise is wrist flexion. Wrist flexion is done by putting your palm up to the ceiling and doing this motion here. Again, we can use our bottle of water, put our wrist off the edge of the table, and then just lift the bottle of water up like this. Again, 3 sets of 15 is a typical dosage that I would prescribe to my patients. Our next exercise is supination and pronation. Supination and pronation is turning our wrist up and down like this, facing our palm up and then down. We can strengthen it again by using our bottle of water and holding the edge of the bottle. And we can just lift the bottle like this. You can make this exercise more difficult by holding the edge of the bottle. Again, like all our other strengthening exercises, 3 sets of 15 is usually what I prescribe to get adequate strength in our supinating and pronating muscles. The final exercise is a functional exercise that works on a combination of mobility and strength. This exercise is a wringing of a towel. All you have to do is get a towel like this at home, put both hands around the towel, move the towel one way with one wrist and the other way with the other wrist, pretty much exactly like the wringing of a towel. Just alternating with your wrist like this, and then repeat 15 times for 3 sets, just like your other strengthening exercises. And that's 6 key exercises that you can use to help with your de Quervain's tenosynovitis. As usual, if you find this video helpful, make sure you press like and subscribe to my channel. And if you have any medical conditions that you would like exercises for, leave it in the comments below and I'll try and make an exercise video for you. Otherwise, I'll see you in the next video.